Hello, everyone. Welcome back to our third episode of Transform 360 podcast, where we dive into conversations that inspire, educate, and empower us. I am your host, Sabar Shad, a pharmacist, mental health advocate, and your guide to personalized well being. Today, we have a special guest and a dear friend joining us, the CEO of Health Coverage Made Easy. Emily Montgomery has over 7 years of experience in health industry. Her passion is helping individuals, employed and small business owners fully understand their public and private health coverage options. Typically, he helps people who are overpaying for the health coverage and are usually frustrated with high premiums, high deductibles, and a lack of network options. Emily is able to help people in 28 states with PPO plans, and I think that's amazing. Emily also works with small business owners that are looking to offer health benefits for some or all of their team members who are paying, I'm sure, more money in the regular plans. Welcome, Emily, and I'm so glad you could join us today.
Thank you so much, Saba. It's great to be here.
Absolutely. Okay. Navigating healthcare coverage, I know it is overwhelming for a lot of people. So let's start by understanding what inspired you to get into the health insurance field and what keeps you passionate about it.
So back in 2017, after about a year and a half of prayer, trying to find something that aligned with my spirit and my finance background, I found a company that its mission is hope, helping other people every day. It's all about serving people from the heart and advising people on what they should do based on their certain needs and their budget. And I have stayed with the same company for over 7+ years. It's a private insurance company that I represent, and I'm very proud of the company that I represent. But my tagline, my passion is health coverage made easy because it's a third language to most people. They don't speak health insurance. And after 7+ years, I understand it a lot more. My why has changed from the beginning. Now, 7 years plus, it's making sure that people have the right financial protection for their time of need, having access to the best care possible, and really understanding how it can financially impact you. And also on a personal note, just I've dealt with cancer in my family. And so I want access to the best care possible for folks. And I want them to be financially fit to be able to handle that as well, and to understand the financial risk and impact it can have not having the right protection. So my why has changed through the years, and right now it's just making sure that people understand their options and they choose whatever's best for them at the end of the day. No matter what, I make a friend out of a conversation.
And thank you very much for sharing that with us, Emily. That's fantastic. I know Emily on a personal level, and she's probably one of the sweetest people out there. For most of us, the same thing you said, like insurance causes more anxiety because it's like a third language to most of us. So, what do you think are the common misconceptions that people have around health coverage?
Well, some people just think that they don't need insurance at all. And in America, it's financially detrimental not to have the right protection. I mean, most bankruptcies are due to the lack of having the proper health protection, and health insurance is a way to protect your finances. So, step one is making sure people understand the value behind it, and then also how important it is to have the right network in order to have access to the best care possible in your time of need. You want to have a PPO plan, preferably, and that's a preferred provider organization, which allows you access in or out of network, and you don't have to have a referral to see a specialist. Understanding how networks work, and then your out-of-pocket max is the other thing that a lot of people just don't get. And that is when your deductible, you pay 100% into a deductible before insurance starts paying a percentage, and that's the co-insurance phase. Most times it's an 80-20 split. You might hear that a lot. That means insurance pays 80%, you pay 20% until you meet your out-of-pocket maximum. So I kind of think of it as a baton race where you're running and you pay 100% up front, and then you're trying to pass the baton to the insurance company during the co-insurance phase. And that's where you're paying a percentage until you finally pass the baton, and then they take over after that. You just keep making your monthly premiums. So understanding how your out-of-pocket max works. And then enrollment restrictions. A lot of people don't understand how you're limited on certain types of insurance on when you can get on a plan or get off a plan, right? So with government plans, you'll hear it called the ACA Marketplace, Affordable Care Act, Obamacare, government, public. Those are all guaranteed plans, right? You can get off of those plans at any time. It is a year-long plan. It begins January 1st through December 1st, typically. And you can get off of it anytime. You can cancel it, but you can't get on it unless you enroll during open enrollment, which is typically November 1st through December 15th, so that it starts January 1st. That's traditional. Outside of that, you have to have a special life event. A special life event is not something that comes by easy, Saba. We're talking getting married, having a baby, moving is a big one, losing your job coverage, like group coverage. And aging off your parents' plan is a fun one as we're adulting. There's a very restrictive of when you can get on it. And then you have 60 days from the loss of coverage to get on Marketplace. So that's something that folks don't realize, that you can't get on it at any time. You have to have that special life event outside of open enrollment. Now, with private insurance, like what I do, I help people every day of the year. I have no enrollment restrictions with my company. So I help people understand, based on their situation, because I might recommend Marketplace if that's the best fit for them if they have a special life event. I work a lot with folks that are in transition. Maybe they just lost their job, right? And they want to look at COBRA as an option, but they don't know that there's Marketplace and there's private insurance to look at. There's other types of coverage out there too, but those are typically the options that we're looking at. But I educate people on, okay, here's where you're at. Here are the options on the table, and then do what's best for you at the end of the day. But people just don't realize what options are on the table. I think that's a big misconception of, oh, I just have what's in front of me. Even when you get on an employer plan, they're like, here's option A, B, or C, right? You don't have to take that. You can actually go through private insurance. You could do employee only for you. You could put the spouse and kids on a separate plan and save money overall. So I always say I make the best cakes. You just got to tell me the ingredients that we're working with, because it might be a couple different cakes, but no matter what, it's going to taste great.
That's amazing. Yeah, that's, I think, the hardest part. Usually just throw out stuff on Google and just put in keywords, see what comes up, and then they would just go with whatever has been sponsored or what ranks first in Google, and that's how they would just choose stuff. So that's amazing. You did mention a very important point. So on a very high level, could you help us understand the difference between what ACA Marketplace is, what is private insurance, like people are confused HMO, PPO plans. So just probably some easy words.
Sure. So I'll start with ACA and then I'll go into the network. So ACA Marketplace Affordable Care Act, that plan was instilled to allow people access to health insurance and give them affordability, but also access if you have a lot of pre-existing conditions as well. So it's a guaranteed option, and there's financial assistance available if you qualify. So it's based on your income. It's based on where you live geographically, right? So you put in your zip code and then you put your income in, and you may qualify for what they call a subsidy. Now, a subsidy is also known as a tax credit. You might hear it as savings. I personally think of it as a loan. If you make more money than you say you're going to, then you could owe money back. So it's like you get a discounted rate if you keep within this echelon of your income. But if you make more money, and especially someone like me who's in sales and your income varies, it's hard to see the future. We don't have a crystal ball. So a lot of people will get bit by that and then owe money back. So I don't like working with subsidies unless someone absolutely financially needs it, and that's their decision, right?
Yes.
So that's Marketplace. It's guaranteed. You can have pre-existing conditions. You just have to get on it at a certain time, right? So those enrollment restrictions apply November 1st through December 15th, or have a special life event outside open enrollment.
Okay.
So that's Marketplace. It's public. Anybody that is citizenship can get on it, right? Now, private insurance is a whole different entity. There's different types of insurance providers out there. There's other types of insurance out there too, like Medi-Share plans, short-term insurance. People might have COBRA as an option. They might be a veteran and go through TRICARE. I mean, there's all these different types of insurance, but the main ones that you're going to see with public insurance is either government or private. So on the private side, there's different types of plans. There's underwritten. And if you've ever gone through like a life insurance application, they look at your medical history. So we go back and we look at claims history and we look at your prescription history, and we can kind of create this low risk pool of people by underwriting them. So it's kind of like car insurance for good drivers, right? It's health insurance for healthy people. So you get rewarded for being healthy. Okay. But I also have, depends on the time of the year, I'll have a guaranteed product for folks that may not have coverage at all, might not have a qualifying life event, but they still want access to a PPO. So it's just a matter of understanding where people are before I make that recommendation between the two. But I hope that explains it a little bit more.
Yes, absolutely. That gives us a very good idea of what to do and what are the enrollment times and what ACI offers. So thank you for
Sure.
simplifying it. Yeah, with all your cool examples, that helped. And
Yes.
my next question would be, how does your company simplify the process for people? Because if you're working with people in 28 different states, how will reach out? Just briefly, if you could explain, how do you work with people in different states?
So I will absolutely address how there's 28 states, so there's 28 different markets that are potentially that I'm working in. You had mentioned about network and how that's different and your prior question, and just to kind of address that,
Yeah, sure.
the network on Marketplace depends on the state. Like here in Texas, a PPO plan is not offered. Okay.
Mhm. Mhm.
But maybe in a different state it is. Okay. So through Marketplace, there's things like an EPO, which is exclusive provider organization. It is exclusive to those providers. You need to have a referral to see a specialist, right? And then
Mhm.
I call it geographically restrictive. You want to make sure you stay in network for your
Mhm.
benefits to be applicable. And then an HMO is a step above. So an HMO is a little bit larger human maintenance organization. You have more of a selection to choose from, but still referral and not as portable. A PPO that I offer, so through my private company, I offer PPO products, preferred provider organization. You get to go to the provider that you prefer, whether it's in network or out of network, and then there's no referral needed. You don't have to get a permission slip from your primary care to go to a specialist. So if you get hurt and you hurt your back, you can go straight to an orthopedic surgeon without having to have approval. Okay?
Mhm. Perfect.
So that's first thing to kind of differentiate the two is I explain that to folks when I'm onboarding or when I'm reviewing different coverage options. I'm speaking to the fact of, okay, here's option A through Marketplace, whatever your state allows, right? As far as network, how that works. But with my company, because we're PPO, we have full access. I call it your all access pass to your favorite concert because you can go backstage, you can get on stage. I mean, it is literally the best of the best that you can get.
That's
So it's just a matter of understanding that specific market. And it goes down to, okay, I have access as an affiliate to look at government insurance.
mhm.
So even if I can't sell those products, I don't sell them, I only sell my company, but I'm
Yeah.
still going to advise on how they work. And I can provide them with the link to where they're not working with telemarketers. A
Mm,
lot of people will just go to the government website and then they get bombarded by phone calls. And I get that all the time. I'm tired of getting phone calls. I'm tired of getting text messages. Well, good news is I can help you. I'll get you where you need to go. It might not be my plan, but we'll get you a plan of action, right?
that's true. Yeah.
So, yeah.
Yeah. And that's very important because most of the time people are looking for someone who can hold their hand and just guide them and then make their informed decision which path do they want to choose. That's big. And there would be one more question that came up was you did mention about pre-existing conditions. That's another thing that most of the times it doesn't get covered, or people have different questions like what happens after a certain age. So do you have any guidance for people who are looking for?
Yeah. And it's more of for people that don't have a lot of pre existing, there's underwritten plans that I would recommend. I mean, I have over a 70-page guideline book for myself that I can refer to or, ask in advance about, I call it a pre screen when I ask my underwriters, would they consider the situation?
Mm-hmm.
And it's not necessarily something that everybody knows about. But if you're relatively healthy, you're not on a lot of medications, you haven't had a lot of surgeries, underwritten might be the best fit, but it is specific on that person's background and everybody's backgrounds differently, right? I will also say for pre existing conditions, like if I'm pregnant, right?
Mm-hmm.
You now have a pre existing condition that not a lot of people realize that if you're pregnant, that's pre existing. So you're not going to qualify for those underwritten type plans.
Mm-hmm.
I also think of it this way, like what if you got into a car accident and then you wanted to add add insurance to it.
Yeah.
So think of it that way. You want to make sure that you have insurance before the accident happens,
Mm,
right? So often people come to me, well, Emily, I just broke my ankle. I don't have insurance. What should I do? Right? So you got to be careful to have protection ahead of time.
right.
Then, as far as exclusions go, you want to be careful with pre existing exclusions on plans.
Mm-hmm.
And sometimes it might just be surgery or hospitalizations not covered for 12 months with that one specific thing.
Mm-hmm.
So you just want to make sure there's no gaps in the coverage.
Right. Yeah.
So that's the other thing is just kind of be aware of.
Okay. Okay. That's good to know. Thanks for mentioning that.
Sure.
Yeah, there's another question because things just come out of the questions. Is there, like, in all of those 7 years, is there any story that has, you would like to share with our listeners, or something that just touched your heart?
Our
Yeah.
stories.
There's something
Yes,
that you
too.
and you were like, yeah, that's how you help someone, and that's what was the benefit they got out of it. So if you would like to share something with us.
Sure. So I feel like I do that with every phone call that someone gets something out of the conversation. My whole tagline is health coverage made easy. I want to teach people how things work. But as far as some really cool stories that I've had in my personal experience, my plans are just incredible that I offer and have a lot of financial protections built in. So I had a gentleman who was a cyclist and healthy as a horse. Emily, give me a high deductible plan. I'm never going to use it. No big deal. Well, he had a critical illness benefit that I attached to the plan. And if something happens via critical illness, we write a check. It's a lump sum benefit and made payable to that client.
Mm-hmm.
So he called me. He says, I've got stomach carcinoma. I've
Mm.
got a tumor in my stomach. I don't know what to do. And I said, well, I'll add you to my prayer list. But the first thing you need to do is go to MD Anderson, right? You have access to the best care possible. So might as well go there. Plus, we're going to cut you a check for $10,000 to cover your out of pocket and give you a little bit of money left over. And then I say, this is for you to be able to focus on your health instead of worrying about your wealth in the meantime, right? So my products come with those critical illness benefits and also accident protection. I have a gentleman that's been in the hospital for over 3 months. It's pretty heart-wrenching. He was hit on a motorcycle.
Okay. Okay.
But he had access to the best care. He has a hospital confinement benefit. He's going to get a check because he's been in the hospital to help replace lost income.
Mm-hmm.
And then his out of pocket's going to go down. There's ways that I financially protect people on top of giving them access that it's just like, hey, this is why I do this. It serves the soul, right? And it reaffirms what I do does impact others. And that, again, aligns with my beliefs. I love it.
That's amazing, and you are so good at what you do. Thank you for doing that. One probably last question would be, you mentioned, like, people who are, because most of the healthcare care plans would cover, and that's what I most recently experienced with my parents when we were trying to get the insurance, that there's like an age limit for, if you're 60, 65, you would not get insurance, or there's something, then we had to navigate through a different pathway. But what are the different options for people who are like 65 plus or 70, 75 plus?
I serve folks from ages 18 to 64 and a half, technically.
Okay.
So I don't do child only policies and I don't service Medicare age. I have some really fabulous people that I will refer to
Okay.
and connect them with to provide them with the proper education because Medicare is another different type of language out there.
Okay.
Yeah, so I don't advise on Medicare. I'm certified and licensed on it, but I don't speak to it. I refer to an expert on that.
Perfect. Okay, that's good to know. That's an excellent advice. So before we wrap up, how can our listeners connect with you and health coverage made easy?
It's as simple as a phone call or a text.
Okay.
And you are welcome to use my personal cell phone. It's 512
Mhm.
567 9091. Or you can go online to my website and request to be connected with me. I mean, honestly, phone, email, Facebook, it doesn't matter. I attend to all of those things as far as connecting with folks. So just
Perfect.
get in touch. That's all you need to do.
Perfect. That's good. And once this podcast goes on YouTube, we would have everything that's needed to, like, reach to Emily. That was an amazing discussion. Thank you very much for sharing all your insights and helping us navigate the complex world of healthcare coverage. And thank you very much for all our listeners who joined us today. And if you truly enjoyed our conversation today, don't forget to subscribe, share, and leave us a review. Until next time, take care and stay balanced. And thank you very much again, Emily.
Thank you.